All right, aloha everyone, and thank you for joining today's COVID-19 Public Health Action Webinar, Improving Community Health During the Pandemic and Beyond. My name is Makamai, and I'm the Public Health Programs Associate at the Hawaii Public Health Institute. Before we get started with our presentation today, there are some Zoom housekeeping that we'd like to go over. Next slide, please. For all questions, please utilize the chat box or Q&A box located at the bottom of your screen. No continuing education credits will be provided during this webinar, and all webinars are recorded and will be available on the Hawaii Public Health Training's YouTube channel. Next slide. Before we get started, I would like to introduce to you all our presenters for today. Tanya Smith-Johnson is a mother of 6, home birther, homeschooler, midwife, and advocate for the midwifery model of care, reproductive justice, birth equity, and the improvement of birth outcomes for Black, Native, and Indigenous people. Tanya is the policy director at Healthy Mothers, Healthy Baby Coalition of Hawaii, as well as the director of the Community-Based Doula program. She is the newly appointed executive director of the Birth Future Foundation and the new president of the National College of Midwifery, a direct entry school for midwives who practice traditional midwifery and out of hospital birth. She is a former adjunct faculty at Midwives College of Utah and core faculty at the Florida School of Traditional Midwifery. She is also a full spectrum doula, childbirth educator, and tobacco cessation specialist. Tanya is a veteran and served in the United States Naval Hospital Corps and spouse to an active duty civil engineer corps officer. Our next speaker is Michelle Tagorda Kama, who is a daughter of a Filipino immigrant who instilled the importance of education and giving back to the community. As a faculty junior specialist with the Thompson School of Social Work and Public Health at the University of Hawaii at Manoa, she works primarily as an academic advisor supporting prospective and current public health students. She has also taught classes, including health promotion theories and practices. Recently, in addition to her work with the university, Michelle is a project manager for the Vaccination Outreach for Hawaii Student Project. This project is organized in partnership with the Hawaii After School Alliance and the Hawaii Public Health Institute to award many grants for activities to increase access to COVID-19 vaccinations, information, and resources for students aged 5 to 18 and their families. Lastly, we have Derek Ariyoshi, who for the past 3 years has served as the county executive for the Elderly Affairs Division, which is the designated area agency on aging for the city and county of Honolulu. In this position, he oversees the administration of federal Title III and the state Kupuna care services to support older adults who live in independent, meaningful, and dignified lives in their own homes and communities. During the COVID-19 pandemic, he helped establish the Kupuna Food Security Coalition and Kupuna Vaccination Outreach Group to ensure our most vulnerable Kupuna have access to food, vaccines, and support services. He was presented with the Ilima Award for Government Leadership by the Hawaii Pacific Gerontological Society and distinction as an Ohana Hero by Senator Mazie Hirono. Prior to his position, he was Hawaii State Director for the Corporation for National and Community Services. While in that position as lead federal representative administering Senior Corps and AmeriCorps Vista grants in Hawaii and the U.S. Western Territories. Prior to that, he served in various administrative positions, both with the Executive Office on Aging and Department of Human Services, Adult and Community Service branch. So before we get started, I'd like to hand it over to Tanya.
Aloha, everyone, and thank you for having me here. As stated before, I work as the policy director for Healthy Mothers, Healthy Babies, but also serve as the director for our community-based doula program. And the ways in which Healthy Mothers, Healthy Babies works is really to just think about wrapping people around with services and resources, and just really just kind of giving people all the support that they need. And what we noticed, during COVID is all the gaps in the system, all the ways in which families were falling through the cracks. So it caused us to really get creative in the ways in which we felt like we can fill those gaps and give people access to the things that they needed. Because you have to think, Healthy Mothers, Healthy Babies, we're seeing, pregnant and birthing people, new parents, people in the midst of their postpartum period. So once COVID hit and really, the inaccessibility of a lot of the services that people were used to, people didn't have support systems, families couldn't, attend births, all of these things. We had to think about how can we help and serve. And so in that, we had to think about the ways in which we can, really just meet people where they were. And with that, we just had to sit and like dream up, like, what is it that, that's needed? And from that is what, came about our Mana Mama program. And not only that program, but creating a mobile van. So literally a mobile clinic to just go out and reach people, go to their homes, pull up and, really provide whatever those services looked like. In the very beginning of COVID, that looked like us providing meals for, pregnant and birthing people who either they just, they couldn't get out, people who just didn't have access to food in the same ways that they did. So we started our Mana I program where we were delivering a week's worth of meals to families. And along with that, diapers and cribs if they needed them. And that program still is continuing on to this day in this moment. Also, the ways in which we use our Mana Mama mobile van is to go out and see people who are needing just kind of clinical services, because our team is composed of not only midwives, but a nurse practitioner, lactation consultants, doulas, nurses. So we were really, just kind of taking that van out, and it's a full service van. If, you all ever have the luxury of being able to come by and see it or just kind of see it out on the streets, it's super beautiful. And we built it ourselves. We didn't outsource that. Our ED and her husband actually built it, with some of the staff, like in the driveway. And that was our way to be like, how do we take services to people who, some people aren't going to doctor's visits anymore. People are scared, especially, as we think about the demographic that we're serving, which are, people who are pregnant, people who have, newborns. And, there were moments, and even we're still in these moments where people are just kind of unclear on the impacts of COVID on, that demographic and community. So the van goes out. And we've also used it in, taking our lactation consultants and really like doing visits right there in the van, or, going to people's homes if they're comfortable with home visits. And then also we had to pivot. And so I would say that's the second thing, we had to do. First was being creative, second is, just being flexible and pivoting at any moment. And one of those pivots we had to do was, as things start to ramp up, starting to provide vaccinations for those who wanted it. So to this date, we probably have given about 1,400 vaccinations and shots, including some people just getting, first doses, second doses, and boosters. But also at the same time, reaching out and giving people flu shots who want them. So the van is, literally, all over the island, going to communities and, serving them in those ways. Families are calling us and saying like, hey, could you come and we want to vaccinate, everywhere from Kupuna to, to keiki, can you do that? And those are some of the ways in which we feel like we can, kind of fill in those gaps, make sure that people are getting what they need, especially people who have access issues, who can't, don't have transportation, or just, can't leave or don't want to leave, and get out, to do those things. So those are, just a few ways. But also what we noticed was that, birthing people didn't even have access to support as they're laboring and birthing. There was a point, some of us, may remember, it's where the hospitals weren't allowing anyone in, including, the other parent or partners, and definitely not family members. So we saw people who, who were potentially birthing alone, birthing not only without family support, but any support whatsoever. So one of the things we had to do was advocacy, right? And just, really, make it known to community and hospitals, like, hey, like, no one should be doing this alone, that, community, is needed for, new families. And so part of, that knowing was, putting out a survey and finding out what is happening to community in this moment and what are the needs. And so with that, we have our community-based doula program that works on a sliding scale, just so any and everyone can, at least try to access it. Those of you who know, like, doula services can run as much as $1,200, but we, figured out a way to make our, our services as low as, $100. At one moment, some people were able to get free doula services, meaning that they had a support person with them prenatally, but also had someone in the hospital with them. That was, specifically there for them and to help them, through the journey and the process of having a baby. One of the most transformative, moments and journeys in a young family and a birthing person's life, right? So with that program continues on. At the moment, we've probably served close to 200 families, in that way, either being, giving, education, advocacy, or physically being in birthing spaces with them. And another thing that happened was that, childbirth education stopped in many hospitals. So we have young families who want information, who want resources, and didn't have anywhere to go. So we moved childbirth education online, and also moved online our parent group. So that's the other part. People needed, support, education, but also needing a community of other people who understand what's happening and what they're going through. So our Pico Pals new parent, support program moved online, which was normally, in person, just so we can still offer, people some level of support. And so that's a 12-week program where people kind of come in and check in, and, they're just kind of, decompressing and talking about all the things. There's various different topics, but what happened in the midst of COVID is a lot of people just needed to talk about what they're experiencing, because no one else has gone through, a thing, like a pandemic and being pregnant and not having their family here or support in the ways in which they thought. Lots of people needed to just kind of talk to someone. And that's another thing that we realized, that mental health services have gone up in the midst of, the pandemic, and making sure that we have mental health counselors and LCSWs on hand for folks. So we have those services as well. So really just thinking about all the ways, be it social, be it clinical, and community supports in which we can, hold space for people and make sure that, that they're getting what they need, and making sure that that's not just something we're doing temporarily in the midst of, pandemic and COVID, but that's something that we're thinking about, long term, and because it doesn't end, and it's a service and it's support and it's resources that people need all the time, pandemic or not.
Great. Thank you, Tanya, for sharing that. Next, we want to hand the mic over to Michelle, and she can share with us all the great things that they've been doing.
Awesome. Thanks, Maka. Hi, everyone. I'm very excited to be here, to be able to talk with you folks about some of the experiences I've had with youth-led efforts promoting COVID-19 vaccination, and just other vaccination efforts that are centered around our youth and how to work with youth and their families. I know there are many ongoing initiatives and activities already going on, and happy to also continue learning from all of you. So happy to connect in the future as well. But one of the things that I have been fortunate to see is this coming together of different groups, this creation of different partnerships, which is a real testament to the practice of public health. And so I'd like to share some of the examples I've seen of youth really stepping up and taking the lead in some of the planning and coordination of activities, as well as organizations really shifting and adding that youth focus to their work as well, and some lessons learned along the way. I know during this pandemic, a lot of us kind of pivoted and added new responsibilities. One of the things I had been fortunate to do was teach my first college class at UH Manoa in 2020. I know many teachers pivoted and had to teach online, teach virtually. And so when it came to the topic on health promotion and health communication, it was an opportunity for our class to really think creatively and what could we do to motivate our college students, our youth in college to play a role during this pandemic to help provide more information or outreach or support their peers in what was going on. And so one of the key things I noticed in working with youth is really encouraging youth to be part of that solution, helping them to come up with ideas, providing them the resources to implement those ideas and go from there. And so as part of our health communication project in the class, college students decided to put together videos, TikTok videos. So although I'm a millennial, I wasn't too familiar with TikTok. So that was something I had to learn from, and was in a learning experience from the youth to share kind of what TikTok was all about, its impact and opportunity to spread good messaging. And so we definitely had to also talk about misinformation and disinformation that's spread on social media, but having students play the part in understanding their role in spreading correct information really motivated them and engaged them in different ways. And so our theme was back to basics. So washing hands, wearing masks, physical distancing, but also getting vaccinated was something that as I taught the class a second time, we added that in now having the vaccine available for youth and young adults. And so it was really a chance to get students thinking about ways they could engage and be part of the solution. And so I was fortunate to see that through my work with the mini grant project, that not just at the college level were students motivated, but also students in high schools. So I learned there's already very motivated students wanting to play a part in making a difference in their community. And so through this mini grant project, we were able to see a lot of great projects that were implemented that looked at, raising awareness. So creative ways of doing campaigns for the schools that were back in person was being able to creatively put together posters, sign waving, but also there were ways to do it digitally as well. So continuing that social media presence and outreach opportunities to reach their peers. And the youth know themselves so well, and we really look to them to be the experts in how to be able to reach one another, have the type of messaging that would make the most sense to resonate with each other and their peers. Other things that we noticed that the youth were able to creatively put together were organizing activities around vaccination clinics. So in addition to encouraging folks to get their vaccine, come to this activity to also learn about health careers. So seeing activities planned along with vaccine clinics were really exciting. And that was one example of doing a career fair along with vaccination clinics, but also being able to pass out hygiene kits or school bags or a toy drive. So those are other examples we were able to see had really made an impact in their respective communities, because it provided more fun and more incentive to be able to go out, not just the students, but bring their friends along or their family members as well. And we saw students really take the lead in organizing and coordinating webinars and reaching out to guest speakers to be able to hold these workshops that were relevant for their peers, but also for families as well to attend. So it really became a community effort. I think a opportunity for the community to come together. And I know Zoom has been an opportunity for us to connect from different places online. I know many do miss that in person, but it was a chance for folks that were able to at least get to hear important messages and information from guest speakers through the Zoom platform. But the really neat thing to see is how the youth incentivized folks to participate. So in these webinars, they made it so that if you answered a question correctly, you'd be entered to win a prize. So being able to, test the knowledge of their peers was something that allowed them to, get folks to come and also provide them an incentive should they have win a prize. So making it fun and engaging was another way that I think really helped to make these activities enjoyable for students to attend. And so incentives is, I think, a great lesson learned and something of a best practice. And how can we incentivize engagement and motivation for students to participate in not just coordinating and planning events, but also in participating and being able to get vaccinated or learn the information or be able to spread the word in different ways. And so I think that incentive thing, the ability to give incentives is something that would be helpful in different communities, but it was important to know kind of what type of incentive would make the most sense. So that was something that the youth really took it upon themselves to know and share about their communities, their understanding about their communities and what their needs were, so that those incentives that were put in place made the most sense. So whether it was, again, like the hygiene kits for the Ma'i project out at Waianae High School, or if it was providing school bags to our houseless youth, along with providing COVID-19 information, or if it was just Amazon gift cards for those who attended webinars as a way to help supplement different types of supplies that they might have needed in the classroom and beyond. So it's really important to think about, again, what the right incentives would be to help your community when working with youth. And that was something, you know, for me as working with the youth, I wasn't sure. And so letting the youth know that they had an important voice to share in terms of what would make the most sense for them, or again, what would draw their peers to these events, or engage them more to want to learn the material. Modes of communication was very important. Another lesson learned, and really emphasizing the use of social media that can be very impactful in how the messaging to recruit participation in activities, but also to get the word out in being able to spread awareness about upcoming events as well. And so social media is a helpful tool to continue using, but also how to engage in different ways on social media is something I encourage folks to get creative with, like putting in games or, again, additional incentives through those different platforms. One of the other lessons learned in thinking about timing of events, because school time, after school activities, but also afternoons, and being mindful of events, let's say webinars in the late afternoons when maybe families are picking up their students or their children from school, which might make it hard for students to participate in certain activities. So it's planning around understanding the school timeline, but also the day of a student's life and what would make the most sense for them to be able to engage. So being mindful of that. That was one of the feedback we received from one of our mini grantees, that maybe a Friday afternoon might not be the best time to have a webinar since folks are transitioning into the weekend. And a late afternoon might be hard if folks are planning to get ready for dinner and so forth. So really thinking about what the community needs and making sure it fits within the times that would make the most sense for them. So I think, you know, one of my takeaways, one of the really neat things I learned from the students is, you know, encouraging to be innovative. One of the quotes from a student that had shared with me who had planned an activity is, be creative. You never know what might actually happen when you dream. And I think in this time of COVID-19, it's really providing that opportunity to get students to engage, to be able to give them the opportunity to take that leadership role, to be part of the solution, to be able to share their knowledge, their strengths, and their expertise, because you know, they have the tools and strategies to be able to inform us, right? Inform us in what would make the most sense in reaching out to them and being able to engage them in different ways. So those are just some of the lessons learned and some experiences I've had working with students, but I did want to take some time to thank the Hawaii Public Health Institute for this opportunity. And I know it's National Public Health Week, and so a lot of amazing work is being done in response to this pandemic, but also in our day-to-day work in public health. So thank you, folks.
Thank you, Michelle. That was great to hear about all the work that you folks have been doing with keiki and around the youth. So now we're going to take it all the way to the farther end of the spectrum, and we'll have Derek talk to us about what they've been doing for Kupuna.
That's right. Happy National Public Health Week. Wanted to acknowledge first, though, Michelle and Tanya for sharing their experiences. Connects deeply with my own, so I want to make sure I acknowledge that. Thank you to Maka, Alana, Hi-Fi team for the platform to share the inspirational and impactful work of our community partners serving our Kupuna during the pandemic through the formation of 2 community coalitions, the Kupuna Food Security Coalition, subsequently our Kupuna Vaccination Outreach Group, and now harnessing the built momentum and partnerships of a newly formed Kupuna Collective. My hope is that maybe in chronicling the origins of the coalitions and celebrating the lessons learned, that there might be an important takeaway to offer, which is truly the power of community partnerships. And in that, we have the opportunity to rewrite our story, hopefully your story, and how we each serve and support our community, and that perhaps strategically, thoughtfully changing the narrative in the midst of challenging circumstances like the pandemic, a narrative that in a place of desperation, that there is a space for inspiration, that insurmountable challenges can become innovative solutions, and that leadership roles that we can all play, whether it be government or community-based organizations, that we have the opportunity to help create energy and momentum for community-driven solutions, for community-based challenges. And I know that it sounds airy-fairy, but I think in the acknowledgement of the work that our community-based organizations have done, I am authentically and deeply believe in some of these, the spirit and the concepts that I'm going to share with you. Now, before the details of how our coalitions enabled us to be coordinated and responsive to the needs of our kupuna during the pandemic, from a public health perspective, it's probably important to know the population and demographic profile of our kupuna. So generally in the past 10 years, we've seen a 20% increase in our kupuna population, while all other age groups shrank. Kupuna 60 plus now represent a little over a quarter of our state population and growing. 43% are either in poverty or struggling to make ends meet. 36% have a disability, 19% live alone, and approximately 35,000 kupuna have limited or no internet access, ballpark 50 to 20% of the total kupuna population. And then we'll see later how that kind of plays into the work that the coalition did during the pandemic. So time machine, rewind back to March 2020, COVID-19 reaches our islands. Governor Ige issues emergency declaration, right? Puts out stay-at-home orders. We all witnessed the hoarding of food and other supplies at stores. And along with core mobility factors, kupuna being identified as an at-risk population, essentially created a sizable group or cohort of homebound kupuna overnight. And in a matter of weeks, Elderly Affairs Division call center, our senior call center, was inundated with calls from kupuna and families asking for help for food and meal resources. And I still think back and of those times and feel the lump in my throat, realizing that there was not a singular organization, including our own, that had the capacity and resources to meet that need. You know, what we see and know, mass care strategies, including mass food distributions, were serving the masses. And obviously, we learned pretty quickly that that did not work for a good number of our other at-risk and vulnerable populations, including our kupuna. I think it was in that place was an epiphany that really mass care strategies does not support all populations. And that subsequently played out not just in food security, but vaccine access as well. So again, during those early days, community organizations and calling us and really asking, well, what are you doing? We had also those unique individuals and organizations, the unique ones, the special ones, asking, how can we help? And really, out of desperation was the origins of the Kupuna Food Security Coalition to ensure no kupuna goes hungry. And in desperation, I reached out to a few individuals and organizations I trusted and respected. We had AARP, Aloha United Way, Kanu Hawaii as well. And then quickly building from there was a pivotal moment to bring in Hawaii Public Health Institute as a backbone agency to assist in the facilitation and coordination of the Kupuna Food Security Coalition, and subsequently evolved to them serving as fiscal intermediary for the monies that eventually came our way. Ro is on the call. She was an important part of that. And subsequently, Lindsay Ilagan, High Five Kupuna coordinator, really did an incredible job in pulling the group together and making sure the gears of momentum were turning. I would say equally important, and really this is what set us apart, bringing in Dr. Christine Nishida, Jenny Lee with UH Center on Aging to build the Kupuna Food Security Coalition's capacity for data analysis and collection, which in retrospect was huge. So to set the stage again, the Kupuna Food Security Coalition is born. No federal monies are even being discussed yet in Congress, definitely not in the pipeline, and no state or county monies available. Really, the coalition's role at that point was largely inventorying existing resources, seeing opportunities, and being really creative in pulling those two pieces together. Elderly Affairs Division, we thankfully received approval to loosen the eligibility criteria for Kupuna home delivered meals. We served as matchmakers, for instance, to help stand up the Show Aloha Challenge, if you all remember. Awesome community leader, Mike Gangloff, Lanai Tobura, and their partners of restaurateurs really approached us and said, okay, we can get the private donations and we can cook the meals. We don't have a mechanism to intake Kupuna and to deploy it. Michelle Cordero Lee, Hawaii Meals on Wheels said, yeah, we'll deliver. St. Francis Health System says we'll do the intake. And then that's where Show Aloha was born. St. Francis did the intake, screening, HMOW picked up the meals at the restaurants and then deployed them and delivered them to Kupuna. Mind you, zero government dollars at this point. Christy and Jenny built our data capacity to identify where the needs are in the community and demonstrating impact where our supports and services were made in the communities. And around that time, desperation slowly started turning to inspiration. And our Kupuna food security members really motivated each other in the work that they were doing. And in that, because we had that data element, philanthropic approached us, reached out to us, wanting to be involved and providing funding support. And once the federal funds were in the federal supplemental funds, including CARES, were in the pipeline, the Kupuna Food Security Coalition had the built networks already and the service infrastructure in place to make, one, a compelling case for the monies, but more importantly, to get them out in the community. And again, through data, demonstrate impact. Again, pivoting or complementing mass care strategies, we brought the services and supports to our Kupuna, to our vulnerable populations. That's the difference. We brought the food support to Kupuna housing properties, the same barriers and challenges for food access. We provided wraparound support services, counseling, health and wellness checks, serving individuals with disabilities, and pregnant mothers too. Tanya, we were very appreciative for our work with Healthy Mothers, Healthy Babies. Real quickly, and I'm going to put you on the spot, Maka and Alana. 1 year later, vaccine rollouts. So help me out here. How did folks access vaccines in the early days? We're going to turn this into an interactive piece. Go ahead.
Wow, Derek, really testing my like.
That's what I'm saying. How do we get vaccinated in the early days?
I remember we were just doing a lot of community outreach. I know, like speaking for myself personally, I know they were doing them at the pharmacies. They were doing, and then they were doing them at the community outreach. But they were trying to go first for kupunas and those who were were at risk.
Yeah.
And I remember myself thinking like, wow, I'm not going to get vaccinated until like 6-7 months after the fact, because they were trying to get more kupuna and those who are the vulnerable populations first.
Absolutely, so, yeah. And they were at the max vaccination sites, if you remember, right? So the same barriers and challenges played out again with the vaccine rollouts, right? It's that mass care type of strategy, which are good for what the masses, right? So it didn't work for Kupuna for a large number of them, right, to access those sites. How did we register, right, for vaccines online, right? And that's a good number of our Kupuna that although worked for the masses, didn't work for Kupuna, yeah? So that's the origins of the Kupuna vaccination outreach group now. We knew that we had a model in place with the Food Security Coalition, and there was something there. we stood up the Kupuna Vaccination Outreach Group, knowing that we thought that there was a promising model that could help in this situation. Yeah. So the goal of the Kupuna Vaccination Outreach Group was to ensure all Kupuna, regardless of geography, digital access, language proficiency, physical, mental abilities, social economic status, have equal access to COVID-19 vaccines. Yeah. Pull together a similar group of healthcare providers, pharmacies, Kaiser, our nonprofit organizations, and we mobilized and organized again. Yeah, same thing, finding opportunities, doing the matchmaking for partnerships. And I think in those efforts, we stood up a Kupuna vaccination registration call center so that they could register for vaccines telephonically. Amazing organizations like Kaiser's, pharmacies and other groups brought vaccines to Kupuna housing properties. Lindsay helped mobilize an in-home vaccine project with Department of Health. We tapped into our language advocacy groups to make sure that we brought interpreters into housing properties as well. So I think that's the story I want to tell as far as the power of community partnerships. And that despite challenging situations, that we can be the heroes in our own stories, and that we don't have to be victims of circumstance. Yeah. So tap in, utilize the power of community partnerships, because in that power, we can navigate through challenges, barriers, political, bureaucratic, and that where there's a blind spot in one organization, coalition partnerships can pick up those blind spots in others, and the baton gets handed off. Yeah. So I think in that, and apologies if I went a little over, Maka, is that so important to kind of take these built energies, built partnerships. To me, the greatest travesty maybe in this pandemic is that we're not taking so much of these opportunities and energies that we have right now to catapult and move us forward. And that's where we built the Kupuna Collective, co-facilitated and co-led by Lindsay Ilagan with Hawaii Public Health Institute, Dr. Christy Nishida with Age Friendly Honolulu, and UH Center on Aging. And this new collective brings together all of these pandemic coalitions, food, vaccines, digital access, our city and county of Honolulu, Age Friendly Honolulu, into a larger Kupuna Collective. And our hope is that we can combine the energies and the built partnerships to elevate, rising tide floats all boats, yeah, to elevate Kupuna issues, but more importantly, find solutions for them. So again, thank you for the opportunity, and appreciate and shout out to all the community-based organizations that inspire and move us. Thank you.
Thank you, Derek, and thank you all to our presenters for giving us such valuable insight on all the work that you folks have been doing. Just want to remind folks, if they have any questions, please drop them in the chat or in the Q&A box, and we'll make sure to pass that along to our presenters. We actually do have a few questions that we wanted to spitball to you folks, and so I will go ahead and call out who they're for, and if you could turn on your mic and camera to answer them, that'd be great. So for Tanya, our first question, was there any reluctance from mothers and families with the transition to virtual services? What strategies were helpful in easing that transition and to ensuring that families were comfortable moving into an online environment?
Yeah, I think more so, I think it was just kind of this idea of this loss of like, oh man, like we don't get to have the experience that we thought we had, like having, in-person things, in people grieving that process, not being able to have, in-person mommy and baby groups, not being able to have support people, actually there with them. And, but also you got the other side of this where people were really scared to do anything in person, and we just didn't know, we didn't have data. We just didn't know what it meant, for pregnant people. We didn't know what it meant for newborns. And even, if they were exposed, there weren't vaccines, there wasn't anything that we can do, and there just wasn't this guidance. So I think, it was two-part, people kind of grieving the loss of what was, but also the fear of doing it the ways we had normally done it in person. So I think virtual actually was a good option for a lot of our services, particularly for folks knowing like it's not going away, because a lot of other services, they just completely went away. Like people just stopped doing them and didn't make that pivot to things on, online or virtual, right? So for instance, like I said before, like childbirth education, all the hospitals stopped doing it. So, just because it's COVID doesn't, people still need childbirth education and know what labor is going to be like an experience. And so we saw that and we were like, we have to do something online, and let's, and we were offering it to people for free. We were just like, just come and we will get on here and we will hold a class. We were even going for people who felt comfortable, we were going to their homes and doing childbirth education with them. So we just met people where they were. Most people were okay with like the parent groups and childbirth ed, and even like doula services when we're in the very beginnings of COVID, doing that online, because people, rather have something than nothing at all. And I think people were just kind of grasping for, we will take it however we can get it, as long as we can get the education and resources that we need.
Thank you. I kind of want to add, like, follow-up question to that. Did you see a change in maybe your staff and how they had to adjust to an online model? Has it been more helpful to them? Do they feel like they have more reach or being able to reach more, mothers and young families because of changing into that online model?
Yeah, we actually did see that. Transportation was always a thing, and an access issue. So it did. But then on the flip side of that is like we just make the assumption that everybody has a phone or a computer or a tablet or some kind of device to check in. And so again, another pivot was we need to get tablets. We need to get, resources. And so we can, for those people who want to show up for our parent meeting virtually, we'll send them out a tablet. But it did make it to where more people, especially, young families, young mothers who have babies, even without the pandemic, most, and just culturally, a lot of us, we don't step out the door with the new baby. We stay inside, we give, ourselves, be it 40 days or whatever, people abide by. It's just not, it's just not a thing. And so I think people were, in those ways, happy about that, and our staff was able to reach people in those ways. We had to pivot in the ways in which we delivered. Like, it's hard to do like childbirth education, and it's, we're like, get on your hands and knees, or like this, hey, partners, put your hands here. And so we had to get creative in the ways in which we taught and the ways we did this on this little square. But we were happy that people still wanted the services, and we were actually able to reach people, that we probably wouldn't have been able to, because they couldn't come in or they couldn't meet up or, get to where they needed to go in those ways. And also we have to think that, with COVID and everybody just kind of coming home, including, keiki coming home, to where people didn't have to think about that childcare aspect because kids were already home. And so offering something virtually actually made it easier for people to do it, as opposed we have a parent group in the middle of the day and people are like, I have kids and I can't, I have school pickups and all of these things, to where people are actually, home and able to, to do all the things there.
Great, thank you for that. This question is for Michelle. Michelle, with the youth that you've worked with, do you think that the youth that you have been working with on this project would like to continue using social media platforms to share information? Have you seen some sort of inspiration coming from the kids that you've been working with?
Yeah, no, definitely. I think it was really a chance for them to get connected with others. And we know that this pandemic has really impacted folks, especially our youth. Mental health has been impacted because of this isolation, when we had to do a lot of the physical distancing and going into lockdown. And so social media was what many youth turned to find that connection, to be able to still feel part of something bigger than themselves. And so those that really took a really interest in engaging through social media wants to continue utilizing it in different ways, whether it's other types of campaigns, other public health issues that might be out there beyond the pandemic. So I think it's definitely an effective communication tool to promote important messaging. And I think it's, with TikTok, especially as I'm learning, there's always some sort of challenge. And so if there's a way to make it a health-related challenge to get more folks involved and continue really honing in onto their role and what they can do to make a difference in their communities, I think that would be great for the youth to continue using. Yeah.
Thank you. This question is kind of for maybe Tanya and Derek, or maybe more so for Tanya, but what could we do in the future to also prioritize pregnant people to receive the same urgency as kupunas, knowing that they are also a very vulnerable demographic? They were prioritized very late, and understandably, since they don't like to do tests on that population, but maybe some lessons learned on how we can do that for the, hopefully not the next pandemic, but the next health crisis.
Yeah, I think, we don't center mothers and birthing people in general, pandemic or not. Like we just don't think about that population first. But, as we think about families and community, it is the center of our community, our mothers and those who are birthing and those who are bringing, a new life into the world, right? And it's central, to our families and community. So I think, and that was one of the things we had to do. We had to kind of shout from the rooftops, like, hey, like, what about the mothers? What about the babies? What are we doing here? And it took a lot, and it took a while for people to, kind of circle around. And I think people just, stayed centered in this, like, we don't do studies on them. We don't, these are the kind of outliers, and we're just worried about the people who are 18, to this range. And, and then we start thinking about the kids, and then we start to think about, mothers and babies in that way. And I think just always, whatever comes up, if we're thinking about, like, how do we serve them first, even if it's not from, a medical standpoint, like, we're not, we don't know whether this shot is safe. We don't know whether these things are safe, but just thinking about, like, what are the things that we can do to keep people as safe as possible? What are the instructions that, we're giving people at this moment? Because there was a moment where no one was saying anything to pregnant and birthing people and people with young children. So everybody was just kind of like, where do we fall on the, the kind of ladder of importance? And as things are coming out, and I think people just need to have some kind of information. So I think if out the gate, we can just automatically think about, like, okay, who are our vulnerable populations? Who are the people most impacted? And if we think about Kupuna, and we think about keiki, and we think about, pregnant and birthing people and mothers, if we think about those automatically, regardless of what's going on, regardless of what kind of decisions we're making, then we'll be making the right choices. Because we take care of those people, everybody else will be okay. The healthy, demographic 18 to whatever, those people will be fine, because we always center them and think about them. So what about all the outliers of the people who are vulnerable? Center them and think about them first, no matter what we do. And then we'll be thinking and taking care of community as a whole.
Maka, virtual high five to Tanya on that one. Yeah. So I think in that she speaks it so eloquently, right? It is acknowledging and identifying our at-risk and vulnerable populations, yeah? Not just kupuna, of course, them included, individual with disabilities, right? Birthing mothers, all of that, right? And that's where, the mass care strategies, right? It fits the playbook and it works for the masses again, yeah? But for the populations that we target and we serve, right, we have to run a different playbook for that, yeah. And to what Tanya said is that in our emergency response model, right, and I get it, we have to be quick and responsive, but largely that playbook, right, is that linear top-down approach, right? You have that incident command center, you have your core leadership team providing situational awareness, and then you're moving vertically, right? But what we've learned, and I put it to Michelle and Tanya, because I think they agree, is that the dynamic nature of the pandemic, that vertical top-down approach doesn't work. And that's where the power of community-based organizations and coalitions is so important, because that's where you leverage all the information, networks, knowledge at the community level to then drive change and solutions bottom up. Yeah. So same with us. It was a hard nut to crack to be at the decision-making table, for sure. And I think in coalitions that you speak with a unified voice, you're not just saying, help us, serve us, right? You're saying, we have the strategies, we have the solutions. You package it, you put a bow on it, you present it to, the powers to be. And then that's where you start making and influencing the decision-making and strategies. So agree with everything what Tanya said.
And high five right back to you, Derek. I absolutely agree. We realize this kind of trickle down method anywhere, economics or anything else does not work, right? And so like we need to start thinking, we can think about it differently. I always think about things as a circle, right? And like if we center those in the center and everybody else is around looking at, how do we serve? How do we help? And we're kind of reaching in. Those are the ways in which we can kind of take care of people. But waiting for things to trickle down, we know that we'll be sitting there waiting forever.
I totally agree. And that's where the importance of key community partnerships really come into play and sustaining those relationships beyond, right? It just can't be when the next public health crisis happens. It's establishing them, and partially with, with the need of a public health crisis or in response to a crisis, but how can we foster those relationships and moving on? So that kind of segues into the next question that we have. So for the organizations that are continuing this work, do you folks have any advice on how to continue the collaboration or build new partnerships and start to fill the pukas that maybe federal and state agencies might begin to drop off, when we start to lose funding? In your experience, have any suggestions on where we can enhance the activities and enhance the reach amongst those puka populations? It's kind of a free for all for any one of you three.
I'll be quick. What I would say is sometimes we have self-limiting strategies and thinking. We confine ourselves, organizations, to a box on what's possible based upon what we've done in the past. But we've broken that down. We busted through that during the pandemic. So we know what's possible now. So that would be my advice: is don't have self-limiting thinking and self-limiting models and strategies. Think big, because sometimes when we think narrow, right, we see community-based organizations as competitors and competitions. We're fighting for the same pot of monies, but I would say think bigger. We're not fighting for the scraps. We're rising tide floats all boats, and in community partnerships, we're going for the big resources. We're going to bring resources into our state, into our communities, and we do that through partnerships and coalition building, to show the power of the community and power of networks, where I have a hold in one area, the partnership builds in the other, and we complement and support each other. So I would offer that.
Yes, piggyback on that. And that's kind of what, what Healthy Mothers, Healthy Babies did, right? We're not just like, held to, moms and babies and birthing people. And so we did get in, coalition and alignment with the Kupuna Council, right? Because we're like, okay, we're serving, what's happening. We have intergenerational families, right? So it's not just this one, group, like, okay, the auntie and, grandma and everyone else is in that same household. So as we're doing outreach and we're bringing food to just the mom, we're like, oh my goodness, like it's everybody else. So how do we, get in alignment and collaboration with other organizations? Because I think what happens a lot of times, we're all working in these silos, and then work gets duplicated. And then we figure out, we're like, oh, it's so many community-based organizations or nonprofits, and these are doing the same thing. Why aren't we talking to each other? Why aren't we pooling our resources and figuring out how we really serve community and do this better, as opposed to being competitive and all the things that Derek said, right? I think we realized, like, hey, we're all like struggling right now. We're all trying to get the things. So how can you and I creatively think about how do we do this, and how can we help and serve each other? And I think that's what a lot of groups ended up getting to, especially as we're all waiting for the money to drop, right? We're like, what's the government doing? When are they going to get us the funds? And in the meantime, Kupuna still needs things. Birthing people still need things. We can't wait. So a lot of us did the work anyway, even when the money wasn't there, because we knew that's what had to happen. So we had to get real creative. When you have very little resources, very little money, that's when, you're the most creative, because you figure out, how do we do this with little? And I think we need to stay hungry like that and creative like that, even when we're in excess, or even when we get the money, and not get lazy about like, oh, we got it. So we don't have to like really, be as strategic as we were and aligned as we were before. So like always thinking like at any moment the ball can drop, at any moment, something else can happen. So let's keep those, those collaborations and those lines of communication still going.
And I think picking back off of Derek and Tanya, I think it's that taking the time to storytell, like what are we doing, what's working, and then you get inspired by other people's work and opportunities to come together. And I think I saw that with the youth, folks being able to share what's going on in their schools, the projects they're working on, and inspired other schools to say, hey, maybe we could implement something similar, something that would work for our community as well. So I think being able to tell our story of what's working, but also reaching out to get that support and see who else we can lean on to move our efforts and our work forward. So.
Mark, I wanted to add one more point, and then, in these self-limiting boxes that we put ourselves in, right? That goes across the board, right? And this is coming from a government organization, right? Is that as we challenge our community-based organizations to get outside those self-limiting thinking and strategies, same thing applies for government, right? And what we identify and what we default to as leadership in government, right? Is that in leading, sometimes you have to acknowledge and take a step back, right? That sometimes leading is not how we typically see leading, right? Is understanding I don't have the solutions, I don't have the strategies, I don't have the capacity to have the ability and humility to ask for the help, one, and then to acknowledge in that leadership role, many times, more often than not, the solutions are at the community level. And it's giving the community the opportunity to organize and empower themselves to address the very issues that are in the communities. It sounds ridiculous, but it's true. And sometimes the role of government and leadership in government is allowing and supporting that process to happen instead of trying to drive it and force it to happen.
Agreed, totally agree. And maybe this because we are kind of running out of time, it may segue into this last question that we have. So how do we get those? We have people who are interested. We have agencies, private donors who want to support these programs in various ways. How can we do our best to share your stories to them in a meaningful way, so that way we can keep the money going, we can keep the activities happening in our communities?
Yeah, I think that looks like, what's happening now, just like, Michelle said, like sharing stories, and sharing the stories of, all of the organizations that are doing the work, putting a flashlight on, like, hey, like, we don't have to reinvent the wheel. There are folks here doing that thing already. They just need the funds. They just need you to donate. I think all of our organizations probably have a donate button or whatever, like how to give or whatever. So I think a lot of it is that just sometimes people don't know who's out there and who's doing what. And so the more and more, like, we know, like, what people are doing, how are you doing it, the better. So I think the more we publicize, the more that we talk story, the more that we share the things that we're doing, the better.
Yeah, I think it's definitely not being shy about all of the hard work that we're doing and being able to celebrate that. So I think celebrating our work, but also each other's work, so lifting each other up, I think is a great way for us to continue moving and celebrating. And I think as we learn from the lessons and kind of the desperations that we had to go through, right? There's so much that I think we're going to lean on each other for. So I think being open to sharing what we've learned and being able to spotlight that in different ways. So yeah, and I think Hi-Fi does a great job of doing that. Bringing folks to share their stories and highlighting the work in the community too. So thank you for all the work that you folks do.
Yeah, same thing, Maka, Michelle, Tanya, perfect. In the storytelling, yeah, being strong in there, right? So I think for the Kupuna Food Security Coalition, Google it. We have a Kupuna Security After Action report. Hi-Fi, in partnership with Elderly Affairs Division, is going to come out with the Kupuna Vaccination Outreach After Action report as well. Be strategic in investing in data collection and analysis, because it is a front end pain in the butt. I get it. But on the back end, amazing things can happen when you invest in that. So it's again celebrating all of our works and our passions, yeah, because in a time of a lot of challenges and disheartening at times, man, there's so many amazing stories and amazing individuals that when we tap into that and use that as a fuel source, stand back, because amazing things we know can happen.
Well, thank you all. I think it's taking us right to the 2:00 hour. So I want to give a big mahalo to the three of you for being our guests today, guest speakers today. And thank you to all of those who've joined us today on Zoom and to our Hi-Fi staff that's been helping to facilitate this behind the scenes. Please make sure to follow us on social media and look out for the next webinar opportunity. We'll make sure to share this recording as well as and everyone's tags or social media handles. If you have those accounts, please let us know and we can share that in a mahalo email to the guests today. Again, take care, everyone. Be safe, be well, and we hope you all have a great rest of your week. We hope everyone. Thank you.